how are these vaccines different than, say, the AstraZeneca and the Johnson & Johnson, which are adenovirus vector vaccines?
Yeah, so the adenovirus vector vaccines work in a sort of different way where they use a harmless virus, an adenovirus, as like the transporter for that genetic information to produce spike proteins.
Okay.
And what we see from the efficacy data is they're just a little less efficient than mRNA vaccines at getting that immune response, but they're still as good as many of our other vaccines. So even though they're using a slightly different technology to produce that immunity, they still generate a strong immunity to COVID-19.
So really, does it matter what vaccine you get?
Truthfully, the best, I think, vaccine is the one that you can get. The sooner we have, a certain level of population immunity that's achieved by people having been vaccinated, the sooner we'll see a decline in the number of new cases and things getting closer to normal.
Yeah.
So both vaccines are very effective, above 60% for the adenovirus vector vaccines, above 90%, around 95% for the mRNA vaccines. Measles, mumps, and rubella vaccine is above 60% effective. We've pretty much eliminated those diseases from our society. So I think, whichever vaccine you're eligible for is probably the best one to get.
But you should get both shots of the same vaccine.
Yes, absolutely. For the 2-dose vaccines like AstraZeneca, Pfizer, BioNTech, and Moderna, you absolutely do need to get the second dose of the same vaccine that you started with.
Right. So lots of people are seeing these vaccines as kind of the light at the end of the tunnel because we, historically, when you get a vaccine, it protects you. You don't get the disease that it's protecting you from. You can't transmit it, all of those kinds of things. But we're hearing things in the media that says, oh, we still have to do all these public health measures. And I'm just wondering if you have, a way to explain why that needs to happen or,
Yeah, absolutely. So it takes about 14 days to get the maximum amount of immunity that you'll get from a vaccine in your body. And then in terms of a community, we also need to achieve a certain level of community immunity, or herd immunity is another word that's often used in public health circles to describe the amount of immunity that's needed at a population level to drive the numbers of cases of a disease down. And so we still have to continue those public health measures until we get to a place of herd or community immunity that the number of cases circulating is low enough that new infections aren't occurring. Yeah. And it's only really by reaching that level of community immunity or herd immunity that we can protect our most vulnerable, because there will be some people who can't take vaccines, who perhaps have an allergy to an ingredient in vaccines or an underlying condition that prevents them from accessing vaccines, or they may just choose not to. And we still need to protect those people by reaching that sort of herd immunity level.
So normally, if we could all access vaccine at the same supply, this process might go a little bit faster. But the reality is that public health measures need to be in effect until all of the things you've spoken about come to fruition, but it is slowed down by vaccine supply. And so it is going to require us to be patient while we get enough people vaccinated to achieve that herd immunity and protect each other. So, we have to embrace this way of living for a little while longer. But it is, it still is a light at the end of the tunnel in my mind, because it's that final piece of Swiss cheese that hopefully will stop COVID from getting through.
I think you bring up a really good point about prioritization of the vaccines, Reagan, in that the National Advisory Committee on Immunization, or NACI, who makes a lot of the decisions or has been advising Public Health Agency of Canada about vaccine prioritization, the reason the rollout, or one of the reasons the rollout has been staged like this, is to prioritize those people most vulnerable for infection or for severe outcomes from COVID-19. So in the context of Alberta, a lot of people have felt frustrated, certain types of workers and things are not getting prioritized for vaccination, But the National Advisory Committee is really emphasizing protecting the most vulnerable as quickly as possible, and then moving to lower risk categories as we go. So that's, I think, an important piece to keep in mind when you're waiting for the vaccine, is that the reason you may have to wait a little bit longer is because we're protecting more vulnerable people than you.
One of the things that I would say to, our fellow Métis folks who are out there is that, anybody who wants a vaccine is going to be able to get one. The province, Canada as a country is absolutely committed to that. It just might not be at the exact same time as your neighbor. And that can be frustrating, right?
It's sometimes even within your own home.
Right? And that's exactly true in our household. So, as a Métis woman, I qualify, 15 years before my husband qualifies. So it's definitely something that we kind of have to wrap our heads around and just kind of take a deep breath, be patient, and know that, we will get there eventually.